is life. Why is movement so essential to our day-to-day life? Well, there's two reasons. One, we need to move to get where we want to go. And two, we need to move because that's what we need for healing. So, I'm Dr. Amy with Physical Therapy for Everybody. Thank you so much for joining me for this live session where we're going to be talking about movement is life. This is the core value. We have 10 core values here at Physical Therapy for Everybody, but this is the number one core value. And it's the one that we talk about probably the most around here, obviously. And I wanted to describe more of it today and why movement is so important for you. So, two reasons. Because movement is important to do what we want to do in our day-to-day lives, but two, movement is essential for healing in every tissue of our body. So the first one, obviously, if you're not moving, you are not able to get around and do what you want to do, right? If you're not able to go up and down stairs without knee pain, it makes it difficult potentially to get to bed or to take your laundry upstairs, just things that you do in day-to-day life. If it's painful for you to get up from a sit to stand because you have low back pain, it is going to be difficult for you to be able to sit down at the dinner table and then get up and be able to interact with your family during that time. If you have a pain in your neck when you're transitioning from one side to the other while you're sleeping and it wakes you up, that is going to be difficult for sleeping, which is going to interrupt your sleep, which is when you're healing and is very important to you. So having movement is essential for absolutely every part of our lives, not just because we want to exercise or because we want to go and do the big things. With the little things, picking up the baby, maybe it's your child, maybe it's your grandchild, being able to hold them, being able to go for walks with your kids right now, being able to ride your bike with your kids, being able to, we just need movement for absolutely every part of our life. Going and sitting in your trunk and having coffee with your friends. We need to be able to move. We need to be able to get in the car and out of the car and sit in the trunk, all those kinds of things. So movement is really required for absolutely every aspect of life. And it's not just for athletes or people who want to go and, go above and beyond and climb mountains and do all of that stuff. It's just our day-to-day life that movement is required. And if you have pain with your movement on a daily basis, on the regular, it really makes life difficult to live and it's painful and people get super frustrated about that. So that's one reason why we discuss the importance of movement, because you need to be able to move to live the life that you want to live. And we understand that. We want to help you be able to get back to that, whatever that is. But the second reason, which is also super important, is that movement is required for healing. So we have all kinds of different tissues in our body, right? We've got bones and muscles and ligaments and tendons and meniscus and nerves and blood vessels, all kinds of things. But everything in our body requires movement in order to be able to heal. So you may have heard of people who have arthritis. And when you get arthritis, what happens is you have a lining on your joint. It's called cartilage. And the cartilage does not get the proper nutrition, and so it starts to kind of harden. So the cartilage is almost like kind of a shock absorber between the two bony ends of the joint, right? So the cartilage kind of gives you a little bit of give in that area, and so that the bones don't, grind on each other, right? But you hear about people as they get older, maybe their knees are bone on bone, okay? Well, that means the cartilage is not there anymore. It's kind of become more like bone, right? So people are like, well, that just happens over time. Well, actually, it doesn't. It doesn't have to, at least. So the thing is with cartilage is that it needs its optimal stimulus for repair. There's your big word for Friday. Your optimal stimulus for repair of cartilage is compression and decompression with gliding. Okay, so the easiest way to think of that, I feel like, is in the knee, because the knee is kind of an easy joint. It's just basically a hinge joint. It pretty much just goes like this and like that, right? You can bend your knee, you can straighten your knee. There's a little bit more to it, but that's pretty easy to understand, right? Okay, so on the two surfaces, you have the femur, the big bone, and then you have the tibia, which is the smaller bone in the lower leg. So those two surfaces have that cartilage in there, right? So when you straighten your leg and when you bend your knee, you're getting compression and decompression with gliding. Now, it's really, really important to make sure you have the gliding, because if you don't, what happens is you actually will, the fluid in the joint will get thick if you don't have the gliding. So the gliding helps to kind of keep the fluid from getting too thick, really. It's kind of like oil in a car. Okay, so if you have a car, especially an older car, that sits for too long, you can have problems with it, right? Because the oil gets thick and it doesn't run as well through the engine, and it's an older car, so that makes it more difficult, right? So that's why it's really important to make sure that we have full range of motion in our knee, because we need to have the compression and the decompression with gliding, because the compression decompression with gliding is the optimal stimulus for repair of cartilage, and that's what it needs to heal. So what happens over time, especially people like to say runners. So runners always have bad knee cartilage. That's actually not true necessarily. There's actually been a lot of research on this recently, and recreational runners, so people who run, maybe a half marathon, an occasional marathon. So it's a little bit different than regular runners, right? Who are high intensity runners. There are runners who run and that's their job, right? This is different. I'm talking about the recreational runners who go running a couple times a week and occasionally do a race. Okay, that's the people I'm talking about here. But the research has actually shown that those people actually have stronger cartilage than someone who doesn't run at all, right? Somebody who's has more of a sedentary lifestyle. And what happens is, because when you're running, you get that decompression, compression, decompression with gliding, right? So that helps to improve the cartilage. It's actually what the cartilage needs in order to get its nutrition. So you actually need to be moving it, right? You need to be walking, you need to be running, you need to be exercising, because that's what helps to heal the cartilage. And that's actually true for every single tissue in our body. Every single tissue in your body, in order to heal, needs its optimal stimulus of repair, or its form of movement that works best for it. So it's different for every single tissue in your body. Bone is different than cartilage, is different than ligament, is different than tendon. Everybody has their own special way that they want to be healed. But if they don't have that movement, then they're not going to be able to heal properly. So when we talk about movement is life, it's not just that you need to be able to move in order to live your life, which is true. It's also that you need to be able to move in order to have the optimal stimulus for repair for every tissue in your body. So let's say low back pain. So how we treat low back pain here is different based on which tissue is actually causing the low back pain. So, in the low back, you have the vertebrae, you have the discs, you have muscles, you have ligaments, you have all kinds of, obviously, nerves and blood vessels. You have all kinds of different things in your back. So what we do is we figure out, what is it that's actually causing the pain? What is the root of the problem? And then once we fix that, we can apply the optimal stimulus of repair so it can heal, and then everything else will heal up. So we don't have, because it won't work. You have to know which tissue you're trying to heal in order to know how to heal it, right? Because we need to know what movement does that tissue need in order to be able to heal. So I hope that this has been helpful. I hope that you guys can understand a little bit more about why movement is so important in our lives here at Physical Therapy for Everybody, but also in your life. And when we say movement, it's the big movements that allow us to live our life. It's the walking, it's the bending, it's the twisting, it's the lifting, it's the reaching. It's all those things that we want to do to be able to accomplish what we want in our lives. But it is also the smaller motions. It is also the turning in your low back, the bending of your knee, the movement in your head so you can check your blind spot while you're driving. All of these different movements are important. And they're important because that's what you need to heal. And also because that's what you need to live your life. So if you have any questions about this for us, feel free to drop them below. I'll be checking this out throughout the day. I'll try to get to your questions. If you have any questions that you would like us to answer on a Facebook Live, feel free to also drop them below. And I'd love to be able to get your questions answered. I hope you guys have a great day, and I'll see you next week.